At reception, a seriously injured 8-month-old kitten has just been rushed in.
Can we see your vet, please?
Yeah, no, I'll get Chris for you straight away. Okay. Just take a seat there.
Thank you. Cheers.
Blackie belongs to Michael's elderly parents.
Tell me what's happened.
Okay, well, he disappeared for a day and a half, mate, and all of a sudden he's just rocked up in the back porch and he's been meowing and, you know, he was actually dragging himself in.
So he dragged himself into the backyard?
Yeah.
Jeez. So no idea of what's happened?
No idea. It doesn't look like there's any blood, so...
Yeah. This might hurt a bit, mate. Come on.
Doesn't look right, does it?
No, the front legs are working okay there.
Yeah.
It's got strength there, but
look at that back leg there.
Yeah, that's what worries me. So he's just hanging limp there? His back legs are basically in an absolute mess. That right leg is just hanging there with no sensation, no movement whatsoever. But to be honest with you, it's the other leg that I'm looking at most intently, because if that leg can't be salvaged, then Blackie has no hope. If he can't straighten out that leg, he can't support weight on that leg.
Oh, okay.
Yeah, mate, this could be a real problem. I thought we'd take a full body shot first of all, just to really check out exactly what's going on.
In the X-ray room at Bondi, Blackie is undergoing crucial tests.
There's no feeling at all in that tail,
No, there's not.
Are you seeing in there, right? This is just a bit of a check everything shot. What's that?
Look at my boobs. It's my possum.
It's hard to avoid them right now. What is that?
It's a baby possum.
In the middle of the X-rays, another of the clinic's orphans has suddenly appeared.
Thought you'd slipped a chicken fillet there for a second.
Chicken fillet. Oh, it's actually the best way to warm him up.
Oh, I'm sure it is. Whatever gets you going, so.
The possum should survive, but sadly Blackie's X-rays reveal sickening injuries. One back leg is paralysed and the other has been badly fractured.
In terms of a cat having so many things wrong with it that you teeter in the brink of wondering whether it's actually worth keeping on going, Blackie's that cat. Oh, they're incredible. What he's been through and the injuries he has are just amazing.
At the Bondi clinic, Michael is confronted with Blackie's X-rays.
His right leg should be sitting like this one here.
Why is it so far back?
See how there it's been pushed right through? So he's fractured his right femur, his right leg, basically where it inserts into the hip joint. And it's been rammed right through.
That's horrible.
Yeah. He's never going to walk again with a leg like that. I know it's hard to take, but looking at that, we're going to have to amputate that leg. It just puts into perspective what he's done to actually get home, though. Dragging 2 broken legs.
He's a fighter, mate, that's for sure.
Telling anyone that their much-loved pet is going to lose a leg, it's one of the toughest jobs a vet has. You don't want to be in that situation, trust me.
Blackie's chances of survival now depend on complex reconstructive surgery to fix his fractured left back leg. There are no guarantees.
Put some pins in there to stabilise that fracture.
Right.
If we don't do that, I'm sorry to say, there's nothing we can do. I'll level with you. To me, that looks like he's been kicked from behind.
Just knowing that somebody out there could have inflicted this horrific injuries to Blackie, it's just horrible, isn't it?
What, for a laugh, for a cheap shot, to impress your mates? I don't know, but it sickens me.
Do your tricks, mate, and get him through, get him over the line.
Sure, we will, mate.
I just hope he's going to be okay. I'll be praying for him.
That leg's still pretty useless,
Yeah,
isn't
it is.
Hey, you'd be better off without it, mate.
8-month-old Blackie is about to undergo a marathon double operation. The kitten's life depends on it.
It's just amazing, isn't it? He's so agreeable to anything you do to him.
Yeah, he hasn't stopped purring the whole way through.
Chris and Dr. Tony Mossman will both be operating on Blackie. Tony is the clinic's orthopaedic expert.
All right, the moment of truth for Blackie. So I'm going to take off the right leg with amputation first of all, and Tony steps in and reconstructs that left leg. So let's go for it. I guess an amputation sounds simple enough. It's just a matter of getting the leg off, but you do have to be careful, obviously, for the fact that there is a very big artery, a very big vein, and also a nerve in there. You've got to find those, Just delicately remove them, tie them off, and then get on with business.
We're back up to 99.
Okay.
There we go.
There you go, Blackie. That's it.
End of an era.
Job is now half done. We've managed to get that leg off. We now move on to the other side and complete the job.
This fracture. So what we're going to do here is put a stainless steel wire to stop it rotating, and then we put a small pin up the centre which holds it in position.
Blackie's major operation is continuing. Chris has already amputated the kitten's right leg. Now it's up to Tony to piece back together his other fractured leg.
Okay, now just pop that back into position.
You just use the same tools at home, wouldn't you, Tony, to fix a broken chair or two?
Absolutely.
Chris, Tony did my cupboards as well. Yeah.
Really?
Yes, he did. Multi-talented.
Good job.
Very good job, yeah.
They're still standing?
Okay.
Still standing.
Straight? Oh, that's good. Looking good for you, Blackie.
Hasn't fallen over. Now, all we need now is the mallet. This pin now we'll drive up so that it's level with his joint surface, and that'll stay there permanently. Now test his leg.
Cats like Blackie can cope with only 3 legs, but having already lost one, it makes this reconstructive surgery even more critical.
It's obviously repairing a leg is always important, but in Blackie's case, this just has to be 100% straight and support all that weight, because if it doesn't work, Blackie can't walk, and that'd be it. That'd be no future for Blackie. This is outrageous. What have we got here? Hey Michael, how you going? Good, thanks. Hello, how are you? I'm Chris.
It's the morning after Blackie's amputation, and the kitten's owner, Andrea, has just arrived bearing gifts.
She's a bit shocked with what she sees. But
No.
it's a bit difficult. You're not shocked?
I'm okay, no.
Yeah.
No. No. Because my husband lost the finger. I go to hospital. You okay, Mrs. Angeli? I'm all right with that. Nothing else.
She's just saying that it's just a shame what's happened to him. He shouldn't have to go through this. That's what she's saying.
But I can tell that he's happy to see you. I can feel that he's purring, and when he stretches his feet out like that, it's a sign of comfort.
Yeah, I'm okay.
Yeah, it's nice.
The next step for Blackie is intensive physiotherapy,
There's still a little bit of swelling around the wound
Yeah.
there, which we'd expect.
Yeah.
but he's not progressing as quickly as Chris would like.
We always give in.
She gives in. You give in.
The kitten will need tough love if he's ever going to get through the pain barrier and walk again.
Good boy.
Blackie, you ready? You gonna show off? Show them what you can do. Come, Blackie.
Oh, wow.
Look at that.
Hey!
You're gonna run off and hide.
I think so.
After 2 weeks of rehabilitation, Blackie, the now 3-legged cat, is ready to go home.
Blackie's just made a truly incredible recovery, and I'm almost in awe of the little guy.
Over the moon, man. This is awesome. This is great.
In the little roll there.
Yeah.
He's just getting used to his new body and the way it works now.
Yeah. Think of that. That's awesome.
See, Black. See, mate, you stay out of trouble, all right?
I'm just totally thrilled. I can't believe it. When I saw him the other day, he was just like down and out, but seeing him today and the way he's been moving around and that, no, I'm just totally shocked more than anything. But it's a great result.
Blackie is now back to the good life at home with grateful owners Andrea and Antonius.
She's just happy, you know, and why?
Yeah, very happy.
Yes, right. Thank you very much. Love me everything. Thank you. Thank you very much.
Hey,
Hi.
so this is Lucky, grey kitten that his owner unfortunately couldn't come in today because she's got COVID. Her friends dropped the cat off, doesn't know anything about the kitten. Hello, yes, just to say you've got an injury on your back end somewhere, haven't you?
In the UK, A young kitten has been brought into Scott's Isleworth practice with a mysterious injury.
All right, shall we have a look at you? Hey? Oh, look how pretty you are. Hello. Oh my God.
Scott is shocked
Oh my God.
when he discovers the nature of the little stray's injury.
Oh, his tail's been ripped off. Isn't that just shocking?
Yeah.
My heart's absolutely broken for this poor little kitten. The injury that this kitten has suffered is absolutely horrific. I haven't got any information as yet, and I'm wondering, has it maybe had an incident with a car, it's run, and the tail's been run over, and the cat's kept going? This was an agonising, almost tearing of the tail away from this poor cat's body. Clearly you can see that we have probably a good couple of centimetres of exposed spinal column. So we're going to have to clean this up.
Before he starts surgery on the kitten,
We make some calls to clients sometimes, but not usually to say their animal's lost a body part and they didn't know.
Scott is phoning the little kitten's new owner to try to find out more information about the horrendous injury.
Oh, hi there, Alice. It's Scott Miller here, the vet from the vet in Old Isleworth.
Hi.
You've got COVID at the moment, haven't you? You all right?
Yeah, I'm fine, absolutely.
God, you poor thing. Just tell me a little bit more about this little kitten.
Yes.
Your friend mentioned that the cat had a bit of a sore at the back end. What did you understand that his injuries were?
He got caught underneath the recliner sofa.
Oh, a recliner sofa. Oh, I get it. So when it reclined, his tail was in the gap.
Probably what it is.
Oh, Alice. Gosh. Oh, you poor things. It sounds horrific.
It was a terrible day.
All right then, Alice. All the best. Okay.
Thanks.
Bye. Bye. Oh my God. I feel so much for this family. This cat's had its tail ripped from its body. That process of amputation was not a quick one. This is just a traumatizing situation for all involved.
The little stray will need immediate surgery to clean up the wound and stop any infection from further damaging what's left of the tail.
Tail or no tail, you're an absolute sweetheart. Yeah. So many animals are called lucky. I think unlucky, eh? Unlucky. Whenever we see a patient that suffered a traumatic tail injury, we always want to check for two things. First of all, that there's something called anal tone, that the bum kind of puckers when you touch it, and that will show they're not going to be incontinent. And the second thing is that they can still use their back legs and they're nice and strong on them, because sometimes when you pull the tail, it can affect the spinal cord further up the body, and that can have an impact on the hind limbs function. So that's good. He's not going to be constipated alongside having this awful injury.
Finally, some good news for Unlucky. His hind legs and rear end seem to be working normally.
Okay, buddy. Sleepy time now. Good boy. Have a lovely dream and try and forget that nightmare you've been through. So what I'm going to be doing with Unlucky here is I'm just clipping up the tail and seeing what's left. Oh my God. Wow. This section at the end is actually a vertebrae. So that's actually a bit of bone. The spine is made up of a series of vertebrae, as we know, and then the ones in the tail stacked along. This one hasn't pulled off completely, but is folded to the side. It's absolutely horrific. I've never seen anything like this in my whole career. I've seen some pretty severe injuries, but one as a result of a reclining chair, well, this is a first for me. So what I need to do is to trim that back and to be able to cover the skin in the area. So yeah, it's a shame that Unlucky won't have a tail, but he's managed to survive this horrific ordeal. He's lost 2/3 of his tail. Unfortunately, he's going to lose a little bit more now. And accidents happen. And I can relate to that because my cat Ricketts has actually had this procedure done 3 times. When he was very young, he got it stuck in a door, had to take a little bit off, then got stuck in a window, take a little bit more off, and then he got attacked by another cat, had to take a little bit more off. So pretty much every few years, Ricketts's tail got ever increasingly shorter. A little unlucky won't miss his tail because he has lost it at a very early stage of his development. This guy will develop perfectly well without it, so he'll be just fine. And that's all done. That looks a lot better, so I can say with complete modesty that I am far better at amputating a cat's tail than a recliner chair. After 24 years, thank goodness for that. Just finished his back end. Just come to the front because I wanted to check his mouth, because my thought would be if my tail was caught in a reclining chair, I would probably try and bite at it thinking it was trying to attack me. And then looking into his little mouth, you can see that he's actually lost both of his bottom baby canines, and there's actually some loose teeth here, so he's definitely given that reclining chair a good old bite.
Scott needs to remove 2 of Unlucky's loose teeth.
Just like when a mountain lion's got their leg caught in a snare, they'll chew at the actual trap, but also the leg themselves. And in this case, this kitten has been chewing and biting at the sofa to try and let this tail go. Yeah, good boy. That's it. Well done. There we go. Poor little man. I hope this is the end of his bad luck. He's not had a good run, have you, mate? You need to start looking after yourself. Good boy. Oh, poor little boy. Yes, come on then. Come on then. Sweetheart, good boy. Good. Just leave surgery to the professionals, okay? All right. Good boy.
At Scott's Isleworth practice, Unlucky's shocking tail injury has been successfully repaired.
Hi there, Alice. It's Scott here.
Hi.
And Scott is keen to pass on the news to his worried owner, Alice.
The surgery's gone very well. So he's lost about 2/3 of the length of the tail, but he's young and I think that he'll get over it very, very quickly. So I really don't think that you should worry.
Okay.
Okay. See you later. Speak soon. Unlucky's owner said what a beautiful, fluffy tail that this little kitten had. And yes, he's been quite unlucky, but he's got away with this traumatic injury. So I'd hope that even though he has a short tail, he will have a very long and healthy future ahead of him.
Gretle's a dear little bobby calf we rescued a couple of years ago. She was born with 3 legs. She's coping really well with her disability.
I've never seen a 3-legged cow before.
At Edgar's mission, Chris's next patient is Gretle.
Having 3 legs actually saved her life. She touched the farmer's heart, who was so struck by this little calf and her ability to get around on 3 legs and cope that they wanted to find a good outcome for her.
How you going?
Hi Chris,
How
nice
are
to
you?
meet you.
Hey, how you
I'm
going?
Kyle.
Hey, Kyle. I can see what she likes. But this is the problem, isn't it?
That's right, yeah, the hoof's starting to compensate there and growing awkwardly.
The problem with her situation is that it's pushing those toes outwards, and those toes are actually becoming malformed. They now need trimming, otherwise they'll keep on growing to the point where she just won't be able to walk. Normally with cows like this that weigh 600-700 kilos, they're in charge. They're the boss here. But here, the odds are a little bit more in our favour.
Yeah.
Provided we can keep some weight on her with Kyle, I think we're a good chance of actually just trimming that foot without any drugs, without any yards,
Oh, that's good.
without any pain.
That sounds like a plan.
Normally cows only give you one chance. If you blow that, you've totally lost your cover and they'll just run away. We've got to make the most of this chance. What I'm thinking is, if I can just get my fingers into her nose, it's really good control for them. They shouldn't really move their head after that.
At Edgar's mission in Victoria, overgrown hooves are putting severe pressure on Gretle's leg. If they continue to grow, the 3-legged cow will soon be unable to walk.
I'm going to be a bit nervous while Chris is actually doing this procedure on Gretle because it is very tricky.
Just going to get my fingers into her nose. Hey. Yep. Didn't really get the fingers in the nose. It's a bit more of a wrestler than I thought. Yeah. She's strong.
She is.
Yeah, she's had to be, you know, and she's tough. She doesn't like to feel like things aren't going away because she knows that she's a little bit vulnerable.
Yeah.
Hey. Come on. Sorry. Let's get a hand in here. Come on. Let's put push her head down. Yep. It's all hands on deck, call in whoever we can, and make sure we get this hoof trimmed right now. I just don't think we're going to be able to get underneath this toe here. So I'm going to have to use the angle grinder.
Yep.
Normally angle grinders are used to cut steel. Today, they're being used for something entirely different.
Yeah. Whoa, good girl, good girl. Good girl, well done. Good girl. Good girl. Well done.
Gretzky, I think we're done, girl.
Good girl. Oh,
We're done.
good girl.
Yeah, I'm happy.
Good girl. Oh,
We're done.
good girl, well done. What did they do to you, hey? What did they do to you? What did that naughty Dr. Chris do, Gretel? Oh.
After everything Gretel and I have been through in the last few minutes, the only way I'm going to feel okay is if we kiss and make up. It's better for you than it is for me, trust me. Oh. I probably had one coming, didn't I?
It's actually better than what I thought, the outcome. We've trimmed both of those front hoofs and it's come up really well.
You got other plans, I can see. You're a girl in a hurry. Don't mind me, all right? He's obviously waiting for you. Before I even have a chance to say goodbye, Gretel's gone. Why is she gone? She wants to show off the new shoes to a boyfriend, Hansel.
When she gets a good bit of momentum, she's got heaps of rotation and thoracolumbar spine as well.
That hip will start to wear properly. I worry about her knee and her ankle though.
In Sydney, Audrey is catching up with good friend Matt, who wants her advice about his beloved Rottweiler, Sunday.
Her only saving grace is that she does so much swimming that she's well muscled. Alrighty, good girl. A lady messaged us on Instagram and said, I've got a dog that's missing a leg. So she shows up with this beautiful Rottweiler puppy and I looked at it and I just thought, this dog's going to change my life. But you can kind of see she's got less muscle on that left leg with a little nubby.
Yeah.
Sunday was born with 4 legs, but on the second day of her life, she needed to have her back left foot cut off, just below her ankle. I don't know the story why. I think a few of the puppies in the litter didn't make it. She was lucky that that's all that happened to her.
How's she going?
Yeah, she's going pretty good. Starting to show a little bit of lameness and limping, and you can tell she's getting a bit sore on it.
Sunday's so important to Matt, and you can see their amazing relationship and bond.
Do you want to party again?
We're a little bit worried because she's starting to struggle just walking on 3 legs.
Come on, sweetie.
In the past, we've managed her with external prosthesis, but that's obviously uncomfortable for her, and she's not really liking having that attached to her leg.
Today, Sunday is walking without her prosthetic foot, so Audrey can gauge how the 3-year-old copes with her disability.
You can see that she's sort of curving around in an unusual way and just kind of bending that right leg to compensate.
Yeah, she's a beautiful dog and I love her, and I just want to see her have a really good quality of life, so I'd love to see what you think and what can be done.
So it'd be interesting to kind of see her in the rehab clinic.
Come on, hey.
After observing Sunday outdoors, Audrey is now keen to get a more scientific analysis of how she walks.
Come on, in this room. What I do at the animal rehab clinic, the way you should think about it, it's kind of like a physio clinic for animals. So anything that a human might go to a chiro or a physio or a massage therapist for, that's the kind of stuff that we do. Up you get.
Good girl.
Stay.
Good girl, son. Stay.
Wait.
Stay.
Matt is a trained chiropractor, but swapped treating humans to co-found one of the world's few rehab facilities exclusively for animals.
Good girl. Good girl. Matt has had Sunday since she was only a puppy and seen her grow, and he's been amazing with her rehab. Clever girl.
Audrey will put Sunday through an extensive testing program before advising Matt on whether Sunday's damaged leg can be saved.
Good girl. Good girl.
I've done every single thing that is possibly available, and even a little bit experimental, to give her the best chance at having a good quality of life. She's my kid, and I want to do everything I can.
I think we both kind of know we leave it any longer, she's going to start coming into problems.
Good girl, Pachacha. Good girl.
Clever girl. Clever.
At a rehab clinic for animals, Audrey is running tests on 3-year-old Rottweiler Sunday's damaged leg.
Good girl.
The clinic's founder Matt adopted Sunday after her rear left foot was amputated when she was just 2 days old.
I was lucky that she found me rather than the other way around. So it was just fate or luck or good timing or whatever it might be. But I'm very glad that she's in my life.
Good girl. We'll give you treaties afterwards, okay?
After a stint on the treadmill without a walking aid,
Alrighty, up.
All right, up.
Sunday now has a prosthetic foot attached, so Audrey can analyse any differences in her gait.
She's using it, which is good. That right back leg actually looks very good. It's nice and straight and she's really extending that knee, and then she's losing that curve in her back as well. So it looks almost like she's walking normally on her good leg. I'd love to see her in the water bath.
Okay, well, are you ready for a swim?
Next, Audrey will test Sunday to see how well her legs work in water.
She's actually kicking that back leg as if it was a full leg.
Yeah, she does swimming 3 or 4 times a week.
And that's probably what's just keeping her muscle mass. Look at you, darling. You enjoy your swims? Sunday is a nice young dog. She's really, really healthy with all the exercise she's been getting. What's also encouraging to see is that her spine's actually sitting straight. So that tells me that if she is allowed to use all 4 legs at the same length, she actually walks normally. How are you feeling about surgical options at this stage for her to try and help her walk a bit more normally?
Yeah, it's scary.
Something needs to be done. We've tried those external prosthetics. Osseointegration surgery is a new type of surgery. It's been done plenty of times in humans, but not much on animals. So instead of using an external prosthesis, which provides a lot of discomfort, using something internally where we screw it into the bone should hopefully provide her more comfort, get her using that leg properly again.
There's no easy road out of this.
Yeah.
We do nothing and she progressively degenerates with the hip and the knee, or we do something and hopefully it goes well, and it might not. So it's scary.
Yeah. Surgery like this is really tricky for any owner, especially Matt, because he has such a strong bond with Sunday. I really feel for him, because if this was my child or my dog, it kind of tears at the heartstrings. You don't know what the right decision is.
I've kind of resolved to the thought that to give her the best chance at a good quality of life for however many years she's with me, I kind of have to go through with this.
Yeah.
3-legged dog Sunday has arrived at SASH for a crucial CT scan that could pave the way for life-changing surgery.
You want to sit up on the couch, don't you?
Owner Matt has agreed to revolutionary technology where a permanent prosthesis would be inserted into the 3-year-old's amputated leg.
G'day, Matt.
Hey, Dan. How you doing?
Hello, Sunday. Come on in.
Alrighty.
But first, orthopaedic surgeon Dan has to decide if Sunday is a suitable candidate for the new and risky procedure.
It's interesting watching her walking around here, isn't it? She really wants to use that limb.
It's like she's constantly got this, trying to touch the floor. I'd say she's trying to kickstart a motorbike.
CT is going to be our best way of knowing where we can potentially put an implant in. Sunday does still have her ankle joint there. It would seem really nice to be able to keep that. The CT will probably give us the information we need for that. Okay, let's get her admitted.
All right.
Osseointegration's a rarely performed procedure. It's been done in small numbers of veterinary patients around the world, but hasn't yet been mastered. Sunday's a patient who we really think can benefit tremendously from this process, but I can't say to Matt, with my hand on my heart, she has a chance of this doing well. There seems to be quite a lot of good bone stock here in her tibia that we should be able to take advantage of. It looks quite nice and straight here, flared at the bottom to stop the implant from moving, and all the things we'd really hope to see here and allow us to move forward with giving Sunday a new foot. Pretty promising.
Super.
Next time we're going to see each other and see Sunday is when we're going ahead with the surgery.
All right, beautiful. Well, thank you very much. Appreciate it.
See you later.
Today's successful scan means the risky surgery can now go ahead.
Come on, Pachacho. Good girl.
After a massive build-up,
You gonna be a goodie?
Matt and his beloved Sunday are ready for breakthrough surgery that will give the 3-year-old a brand new leg.
You don't want to get out to your Pachacho. This is not a negotiation today, I'm sorry. To me, today was an inevitability, and I am terrified that something will go badly. But I almost feel bound by fate that there's been so many things fall into place. I sort of think this is meant to be. Come on.
COVID restrictions mean an anxious Matt can't be with his adored Rottweiler for the high-risk operation.
Give me a kiss. Good girl.
After a goodbye kiss, Matt hands Sunday over to orthopaedic surgeon Dan.
Sunday, who's that?
Hello, sweetheart. You good girl. G'day, Matt.
Dan, how you doing?
So we reached the day.
Yes.
How's she doing? Is she all ready to go?
Oh, she's more ready than me.
A lot of anticipation for the big day today and getting the team assembled, all the right people here to really give her the best chance of a good outcome. So plenty of nerves after so much of a build-up.
Oh, I'm going to miss you, big girl. Hey, kiss.
Oh,
That'll do it. All right.
good girl.
Off you go with Dan. Make
Okay.
sure you bring her back in one piece.
Speak soon.
Thank you.
Okay, come on, Sunday.
I don't think there's an easy way to put someone you care about so much into a risky situation, but there's no going back now.
Once inside, Sunday is sedated and prepped for the historic surgery.
Sunday couldn't possibly know what's ahead of her. Hopefully she's delighted with the outcome and everyone else is too.
Very good. Excellent.
If all goes well, Sunday will be one of the few animals in the world to have a metal implant inserted into an amputated leg.
You happy if we proceed?
Yeah, let's go.
Okay, let's get going.
Dan leads the team, which includes Dr. Munjid, a world expert in human osseointegration surgery.
Gently and delicately. Okay.
It's a delicate and painstaking procedure that works on humans, but is rarely done on animals.
So we need to bore the canal of the tibia to the size that can fit the implant. There is no room for haste here because the bone that we take out can clog and create much more friction, and that can break the tibia. If we shatter the tibia, then there is no chance for inserting the implant.
And if that happens, the whole process will fail and Sunday will be worse off than what we started. I cannot hide that I'm anxious. Working on an animal is very different to the human, where the bone is much bigger and we know how much torsional force the human being can tolerate. However, none of us have the experience with how much Sunday's bone will tolerate.
What I will do now, I'll check the position of the borer inside the tibia.
Munjid and his team have finished drilling into Sunday's leg without fracturing the bone.
Table up a bit, yeah, go for it, Alex.
An X-ray will show if the hole they've made is the right fit for Sunday's implant.
This looks very well. The reamer is in a good position. We have some thinning of the bone on one side, but it's in a perfect position. Okay, we reached the final stage.
If something dramatic's going to happen, it's going to happen right now, and we're all a bit nervous about that.
So we need to go gentle and slow in order to insert the implant without fracturing the tibia.
This is the critical step. We've got to the point where we've made the hole in the right spot, but now we're trying to fit an implant. We know that there's not a lot of extra bone left in her tibia after we've dug this big hole. It's a time that we're all going to have a little bit of finger crossing going on.
As the surgical team again worries they could shatter Sunday's leg, her devoted owner Matt is anxious his beloved Rottweiler will come through the risky procedure.
It's a high stakes, high emotion thing for me. I hope she's going to be okay. I'm concerned, but I'm happy that she's in good hands.
I think we can call it off now. Excellent. You can see the relief in the...
Beautiful, well done.
Let's have a look at the x-ray now.
Munja, Dan and the team are overjoyed. Sunday's implant has been attached safely to her tibia.
You can see that's sitting very snug. Looks good, looks very good.
Minutes later, the high-risk, high-tech surgery is over.
Great job. Thank you so much. Great job. Excellent. Thank you very much.
We have the implant coming out through the skin at the bottom, really nicely firmly attached. We're really positive about what we've been able to achieve here.
This can open an era of using this kind of technology for animals that have lost limbs. So it's very exciting.
Matt, g'day.
Hey Dan, how you doing?
Oh, it's good news. All the surgery's gone ahead without any concerns. The implant's exactly where we wanted on the post-operative x-rays. It all looks really, really positive, mate.
Awesome. Good to know.
It'll take several days before Sunday is out of hospital, and then months of rehab to help her get used to her shiny new leg.
Not being able to be with her because of all the COVID stuff, it's probably equal parts difficult for both of us. I'd love to be there to make sure she's okay. We'd find a lot of comfort being there for each other. So it's going to be difficult for both of us, I think.
Good girl, Sunday. Good girl. Been through a lot, haven't you? You've done very well. Good girl.
Nice and slow. Good girl.
It's 3 months since Sunday received her brand new surgically implanted leg.
Look at you go, you're so clever. Sunday's really liking her new prosthetic foot. When she's got it on, she loves it. She walks happily, she runs, she jumps, she plays. She's just very comfortable with it.
Audrey can't wait to see how her star patient is going.
Hi, Matt.
Audrey.
How are you?
Very good, how are you?
Good. Look at your leg.
Yeah?
Look at you. You look so happy. It really couldn't have gone any better.
That's good timing.
Slap me on the face.
Around these parts, Bridget and Paula, the twinnies, are renowned for their passion and dedication for rescuing pelicans. Now today they've called me in to help out one that has a mysterious condition that has even them stumped.
Chris is on the Gold Coast to meet a couple of familiar old friends who are dedicated to the care and rehabilitation of seabirds.
Hey twinnies.
Hello.
How are you?
Good.
Good to see you.
Yes, good to see you too.
So this is the girl, you nearly got a kiss as well.
Yes.
This is the girl you told me about?
Yes, yes we did.
Does she have a name?
Yes, we've named her Flipper.
Okay.
And you'll know why.
Just look straight down there, yeah.
Yes.
Wow. There's no doubt about it. Right now, Flipper is in a bad way. She's just missing all that webbing, and really that foot of hers just looks so fragile now. How's her general condition?
She's in good body condition.
Flipper was found by a member of the public who came across the stricken bird while out fishing.
When we saw Flipper for the first time and looked at her foot, we've never seen nothing like it before, so we couldn't really tell what's really happened to her.
And you can see the problem straight away. She's missing really that whole section there.
Yes.
And the fact it's not there worries me, but to be honest, what worries me the most is that. This black colour really says that we've got dead tissue there. A black discoloration to any part of the body essentially means the blood supply is gone and that tissue is dead. This toe is not in bad shape.
No.
But you can just see where that webbing ends there.
Yes.
It's just hanging on for its life.
Chris has been called to help a pelican in distress on the Gold Coast.
These ones here, and even this one up here, isn't looking great. I'm looking at that dead tissue and thinking, how am I going to treat it? But before I work out that, I have to understand what's actually caused it. The way it looks, I would say either she's been bitten by something and she's got an infection after that.
Yes.
Whether that's a shark, that's a possibility, or whether she's stood on something and got a little electric shock. Because that does look like an electrical burn.
Yeah, it does, yes.
There was no fishing line on her, was there?
No, there's no fishing line, but you can see the
see that?
old scars. Yeah.
All sorts of different possibilities as to what could have caused this injury are swirling around my head when all of a sudden my finger runs across a little groove on the leg. I mean, that is quite deep, and that goes right around. See, that's interesting, because if she's had fishing line around there, that acts like a tourniquet, as you know, and so it starts to affect the blood supply to the foot below it.
Yes.
I actually think the blood supply has been so badly affected to the lower part of the foot, and especially the webbing and the end of the toes, that they're no longer getting blood. And when tissue no longer gets blood, it starts to die off. It's like pieces of this jigsaw puzzle are falling into place before my very eyes. This fishing line wrapped around the leg essentially acted like a dam on a river. It blocked off almost all the flow. So further downstream in the toes or the webbing simply missed out. It went dry, and therefore the tissue has died off. So that's important, because what it tells us, and I think this is good news, is that we don't have a nasty infection raging that's trying to work its way up the leg. We've kind of identified the reason why this has happened.
Yes.
And now we also know that the blood supply should be returning back to that foot.
Yes. Yes.
The key now is to check whether that fishing line being wrapped around the leg for so long has caused a permanent problem. By simply pricking the webbing with a needle, we'll know straight away if that blood supply is present.
Oh, they're good.
Wow.
That's a good sign, isn't it?
Yeah, it is. So we've got blood supply there.
Yes.
And that's in the webbing. So that says to me that webbing's probably going to survive. Now I know this foot is viable, it's important to make sure we don't have any further infection or any further damage to this tissue. There's not much left, so we have to make sure we preserve what is there. Before we can fix this foot, the next thing I want to do is just see how she's supporting her weight. Because that's going to tell me how painful this foot is.
Yes.
On the Gold Coast, Chris is assessing the severity of Flipper the Pelican's injuries.
She's taking, I would say, about 80% of her weight on her left leg, and that's going to cause problems in that leg too.
Yeah, well.
Flipper lost most of the webbing and toes on her right foot after fishing line cut off blood supply further up the leg.
First, let's clean this foot up, and then, while we're doing that, I'll try to work out a way to actually make this foot a lot more comfortable and a lot more functional.
You'll do it.
Thank you. I hope so.
Chris now needs to carefully clean up the infected area.
I don't really want to be too vigorous in there because we've already got very raw tissue that if I expose it, it increases the risk of it getting a secondary infection.
Oh, okay. Well, Chris has been gentle, isn't he, huh? Yeah.
Okay, that's looking a lot better now. So
Yes.
that antiseptic will stop the bacteria from invading into those open wounds.
Yes.
That's a start. What's really going to help is some antibiotics.
The antibiotics will treat any infection or disease caused by bacteria from the injured foot.
We'll just do a little sting in this.
All right, so between the antibiotic and the antiseptic, I'm confident now that bacteria invading into this wound isn't going to be such a big deal.
Yes, okay.
All right.
That's good to hear. Yes.
But I still think the biggest issue we've got is this pressure problem. She's just not comfortable enough or confident enough to put anything like what she needs to in terms of weight on this bad foot.
Yeah.
What really worries me about Flipper right now is the fact that she's a big bird. She weighs 6 kilograms, and all that weight going through one foot. Any bird is susceptible to a foot problem called bumblefoot. It's caused by too much pressure going through the feet and infections being the result of it. I think I might need to go for a drive.
Okay. Wow, you're already on top of it.
I wouldn't say that, but I've got an idea about what I could use.
Okay. I'm not sure what Chris is up to, but he's on top of things already. He thinks so quick, he's just amazing. We know that Chris can fix Flipper.
I made a bit of a habit of coming up with interesting solutions for the twinnies, and today might be no different. So, it looks like I bought a yoga mat, but it's not.
Chris has come up with a creative solution for injured Pelican Flipper.
You've actually given me the idea for this. We're going to give Flipper, or Flip, her own flip-flop. Because what we need here, it's cushioning, sure, but also we need protection for these toes that are still there.
Yes, that's right.
And we need a way to make her more comfortable so that she will actually start to put weight on this foot. I'm thinking, what's the most basic form of footwear that offers some sort of comfort or even support? And suddenly, it hits me. It's thongs or flip-flops. So, what I want to do is lay this out. Then I want her foot,
The good one or the bad one?
the bad one. I want her foot comfortable. Okay. So now, go right around it.
First of all, Chris needs to make a protective base for Flipper's injured foot.
So that is a good starting point.
Then, with the help of a reverse template of the Pelican's good foot, he can start to put together his master plan.
We love Chris's idea of the flip-flop and for Flipper's foot, and we think it is going to work.
Pretty sure I haven't done this much arts and crafts since kindergarten. Right, so that's Flip's new foot.
Yes.
You can see where her existing foot is going to go in. And then, once those little toes are in there, we need to now secure them across the top.
Okay.
And the way we're going to do that is with this.
Good old Velcro.
Good old Velcro.
As Flipper waits patiently, Chris is attaching the Velcro that will help keep the shoe in place, along with some cushioning.
Okay.
Yes.
I think I'm ready for our patient.
Okay.
I feel like a podiatrist.
At the Twinnies Rescue Centre, Chris is ready to try out his carefully crafted shoe on Flipper the crippled Pelican.
A little sweetheart.
This is really make or break for Flipper. This has to work, otherwise she could be facing a lifetime of problems. Let's hope it fits, huh?
Yeah, it looks like it's perfect.
So just like the straps on a pair of sandals,
Yes.
we'll start to put these across. So we're happy that it's sitting in there nicely.
Yes.
Nothing's rubbing, everything's been cushioned. Okay, it's a pretty good fit.
Yes.
I've got to say, I'm actually pretty happy with that. It is a lightweight fix for a heavy bird problem. So it's just going to take some getting used to for her. So once she feels like this is how it's meant to be, and becomes her new normal,
Yes.
then she'll start taking the weight off this left leg
Yes.
and shifting it onto the right.
Yes.
And we can start doing that by lifting up the left leg.
Yeah.
You see now, all that weight is through her right leg.
Yeah.
Really, a little bit of physio like that from the Twinnies, and in the next few days, we should really start to see Flipper starting to walk more normally and spread that weight more evenly. And that would be a perfect result. Put her on the ground. Let's have a look. I'll move this away.
Perfect.
What do you reckon? What do you think?
Oh my God. See? See?
Your pair of
Oh.
shoes. Yeah.
Hey. You're happy, miss?
A little flap of approval from the Flipper.
No, look, she's walking perfectly.
She just wants to show off the new shoes to the neighbours.
That she's got it even on there. Perfect fit.
And she's standing a bit more square, isn't she?
Yeah, oh, what a sweetheart. Well,
Amazing.
you've done another good job. This challenge, again, what Chris has done, he's an amazing vet, and that's why we always keep our challenges for Chris.
All right, we'll leave her to rest.
Yes. Here you go, darling. Look at you.
I'll be honest, when I got the call from the Twinnies about Flipper, I had serious concerns that maybe I wouldn't be able to help. But thankfully, there's been just enough webbing there for me to make some sort of difference. As I've learnt in the past, these girls have incredible powers when it comes to rehabilitating these birds. So in the future, I can't rule out the fact that one day, Flipper might be able to kick off those shoes and go back to the wild. Okay, Twinnies.
But thank you again.
No worries at all.
Thank you again.
You're all right. It's always a surprise.
Yes.
but always a pleasant one.
Yes, and going to be plenty more.
Oh, it's not my God.
We hope.
So do I.